posterior lateral corner. So it's a rotational, you know, a rotary component, rotary stability test that we can do. And the reason I put that one in there, the other one that we can do is going to be the crossover test, but you're not putting your hands on them, so I don't like it that much. Similar to that of the Thessaly, where we do it in 5 degrees of flexion, and then we have them go down deeper in about 20-25 degrees where they're holding on. Because when they say they have pain, my fingers aren't where it is. So when they say they have pain, then you got to get them to specify where that is. So I like to do most exams, especially provocative exams, when I can actually palpate at the same time. That's why I like the O'Donoghue, McMurray, and that's where the majority of them will be done. But that one's more simple than that of a pivot shift, okay? And it's for more PCL than anterior instability, or anterior medial, or anterior lateral instability. And then you can do the crossover. So the crossover, it's not on your thing there. We won't do it for lab, but we'll talk about it. So let's start with the Godfrey's, and you can simply, when I had a PCL, my first PCL I saw was at Kentucky gymnast. She was in this position, and you could see the sag. So whenever you remember the slide where our guy's doing the quadriceps active, and he's kind of got, let me see this chair right here. You can see him in the slide, and he's sitting here like this, and he's looking at the knee, right? And you could see that sag, okay? The PCL that we had, you could see that sag that was just right there in front of you. And so that is the sag that we're looking for in this Godfrey's if we push them up here. Now, in some of the slides we saw, they had both legs up here. You've got them like this, and then you're comparing going across. Okay? The only problem with that is that's kind of hard to do, and especially if you've got someone that's had a traumatic knee injury, right? So they're like, no, you know, all the trauma that's going on with her, and then, you know, what happened to her when she was 10, because we got to keep in mind the whole mental wellness part of it, you know, and she remembers, you know, what happened with grandpa and, you know, and such stuff. I'm just making stuff up. So anyway, I like to just kind of put them in this position and then just do the single leg so that I can look at it here, see if I've got any sag at all, and then I can bring them up to this position, just let your leg hang, and if we can possibly get them up there and just check that, depending on how they're responding. So things that we can look at for the PCL is going to be posterior drawer. I like to try and set it. You go ACL, PCL, pushing straight back. Nice, good push. Okay? You can obviously look and see. And then you've got your Godfrey's if you're in suspecting that we've got a PCL injury. Okay? So, how do I want to see this done if you get Godfrey's in lab? I just want you to put them into this position. You got them in this position to look for that sag, and then furthermore, bring them up here and look. And I would recommend maybe doing them independently rather than holding them both at the same time if you're going to do the other side, just to look and see if you can actually see a sag. Okay, looking for that camelback, right? So they got a sag here, so there's going to be a bump, and there's going to be a bump. So I've got a little sag there in that PCL, or in the patellar tendon, because my tibia is sitting back like that, and so it's going to look kind of funny. Okay? All right? Everybody good on that? So when we're doing the Godfrey's, put them in this position, and then I want you to bring them up here and just tell them to relax right there, and then you're going to look across there, looking to see if that patellar tendon, that bridge is there. If that bridge has a sag in it, we got a positive Godfrey's. Quadriceps active, we've already got them in this position, right? We're right here. We can see if there's a sag from one side to the next, and then I'm going to encourage her to kick forward like this, except I'm not going to let her move. She's just that little bit, rest. So I don't have to have them kick hard. Now, if I have the sag, this quadriceps active is going to take the sag away, okay? So they're back there, and then I'm going to have her slide her foot forward, relax. It would take that sag out of there, okay? So if I'm suspecting that. So I'm going through my real time, and I'm suspecting a PCL. I can go deeper into looking at this PCL in this way. So I suspected it in my from my mechanism, I've done my real-time exam. I had the posterior drawer. That kind of feels like that. I've eliminated my other stuff. Now I want to look at it a little bit closer. I might put them in this position here, look at them like this, bring her up here like this, see if there's any sag, bring her down here, kick against me, and see if I can look at that PCL a little bit further. Does that make sense, everybody? Okay. All right. So now another one for external rotation dial test. Let's go ahead and flip over onto your stomach. And we're going to do this at our best guesstimation of 30 degrees. Go ahead and relax. There you go. And I'm going to bring her to 30 degrees, and I'm going to externally rotate. And all I'm looking for is to see if it's different from one side to the next. If there is a difference at 30 degrees, that's posterior lateral corner. Okay? If I bring her up to 90, and there's a difference, posterior lateral corner and PCL. Your big thing is, the one thing that I want you to remember is that at 30, if I get a difference, posterior lateral corner. At 90, I'm looking for PCL. If I'm getting at both, it's both of them, right? If I'm getting a difference in that external rotation. If I only get a difference at 30 and not at 90, maybe my PCL is okay. If I'm getting a difference only not at 30, but only at 90, maybe I've got an isolated PCL. Isolated PCL injuries are very strange. We actually have one with football right now. Okay, isolated PCL injury. Very weird. It's just by itself. Usually with PCLs, there's going to be other stuff that goes on with it. Okay, so external rotation at 30, looking for posterior lateral corner. At 90, posterior lateral corner and PCL. Okay, but I like to just simplify it by my 30 degrees is posterior lateral corner, 90 degrees is PCL. Okay, and so if I'm getting it at both, I think I got both. If I'm getting it at 30 and not at 90, posterior lateral corner. If I'm not getting it at 30 but I'm getting it at 90, PCL. Not a great test. You're not going to see a lot of our physicians do them. Okay, it just doesn't happen that often.
When you say you're looking for a difference, what do you mean? You're looking for a difference in the way it feels?
One side versus the other. So if I externally rotate and this one goes whoop, goes way out there, and it actually makes that noise, I'd call somebody right away. If it goes whoop, okay. So, but you're just looking at difference from one side to the next. We're not going to measure that, but the best thing I can tell you on a lot of these exam guys is when you get your first one, you're going to go, that's what it's supposed to look like. Trust me. First, go ahead and flip over. First MCL I ever got, I'm hoping that guy wasn't looking at my face, right? I was at Georgetown College. I've been in college, I've been, pushing on knees just like you guys. He's at practice. He goes down. Man, he's hurting. Oh, wow. Hey, man. Okay. So, I'm all excited, and he's mad. No. Okay. Now, when I do my valgus and my varus, I'm going to get them a little bit off the edge of the table. What I want to watch to help prevent is that internal rotation of the leg. We talked about that with the other exam the other day. I can't remember what it was. I don't remember. So what I want to do is I'm going to grasp the heel here, and I'm going to pull just a little bit of traction on her leg. Okay? A little bit of traction, and then I'm going to valgus stress at 0, and then at about 25 degrees. I'm going to isolate. See that movement right there? Okay? Isolate MCL at 20 to 25 degrees. Then all I got to do is change my hands. Let it rest. There you go. I'm going to do her at 0 and then at 25 degrees. You're going to get a lot more joint play with your varus. Why is that?
Because it's not in the capsule.
It's not attached, hugged up to the capsule. So you're going to have a little movement before it grabs, before it's nice and tight. Okay? So get with your partners, and we're going to do Godfrey's, and we're just going to go